The B.F.L.A. N.H.I clinic has launched a project to support their diabetic patients because since the pandemic started, fewer diabetic patients are going into the clinic. According to Dr. Natalie Bruce, many diabetics and other patients are fearful of being exposed to COVID-19 at the facility, and so they don't visit the doctor to check on their health.
So as to make a connection with the patient and still be in tune with them in terms of follow-up or questions or concern that they may have, as well as newly diagnosis, we decided to start a support group so that we're able to reach out to our patients as well as to give information to others that may be inquiring about diabetes. So you find that the patients, they will prefer to do the refills rather than coming in to get their proper examination at the clinic. You also have patients that are not properly controlled because some of them, they might not have that support to bring them into the clinic. Some of them go months without their medication, and so when they do return, the blood sugar might be high or they might have certain complications, for example, infections that may not have been attended at home.
For that reason, this diabetic support group will be doing community outreach as well as other forms of online support. Administrator Cheryl Gabriel says they will start with testing and education to help Belizeans reduce the chances of their condition leading to more serious health complications.
Within Belize, diabetes is very prevalent. And so the more you know of your condition and the more you know of where you are as a patient with diabetes or not diabetes, it's best for individuals to understand where they are on a daily basis. And so the clinic in itself assists individuals who come in to see us with proper management of their diabetes. And so we don't want to, at our clinic, we don't want you to come in already having diabetes. We want prevention. So we are looking at it from a preventative perspective. You come in, you check what's going on with you, you understand where your glucose levels are, and we go from there in terms of management. If some people surprisingly come in with a glucose level of 300, 400, and then they become alarmed, and it's like, what have I not been doing? And so we are saying to individuals, let's check, let's get to know where you are before it reaches that point.
Misha King lives with diabetes. She has volunteered at the clinic because she wants more young people to educate themselves so that they can manage or prevent this disease.
We're currently working on the Walk to Freedom, whereby individuals can come in and join us and help walk, to fight diabetes. We want to promote healthcare, we want to promote being healthy and to eat healthy. And, being a diabetic myself, I understand, and also as a young person, I want to encourage other young people that you can't just be eating any and everything. I never expected to get diabetes, but I did. I gained over 200 and something pounds. And, after that, I was diagnosed with diabetes. But, I lost all that weight and everything. And right now, I'm managing my diabetes with insulin. With this project, we're hoping to reach out to them to prevent them to having to take medication on a whole. Because taking insulin and injecting yourself 2 times a day is not a pretty sight.
Reporting for News 5, I'm Andrea Polanco.